Evening, everyone. Welcome to this webinar on the progress of household drinking water, sanitation, and hygiene 5 years into the SDGs. My name is Rick Johnston, and I co-lead the WHO UNICEF Joint Monitoring Program, along with Tom Slaymaker from UNICEF, who's also on the call, and this will be a joint presentation. We've got about 2 hours for the sessions today, and we're going to break it up into 4 different blocks around drinking water, sanitation, hygiene, and menstrual health. Each of those will be followed by an open discussion and Q&A session, so we do hope to hear from you during those. Feel free to tap your questions into the chat box, and we'll be monitoring those as well. And you should see at the bottom of your screen that there are interpretation possibilities, so please feel free to join the French, Arabic, or Russian channels, so you can hear in the language of your preference. And now, just before we get into the discussion about these specific targets, I'd like to share a message from the Vice Chair of UN Water, Kellyanne Naylor.
Dear colleagues and friends of water, thank you very much for joining this webinar today to discuss progress towards Sustainable Development Goal 6. This webinar is part of a series of webinars taking place this month, each focusing on global progress towards a specific SDG 6 indicator and target. Before we get into the details, I wanted to share a few important messages about overall progress towards SDG 6 and how the UN is working together to report on our progress. We are now 6 years into the SDGs. And for the first time, we have water and sanitation data from almost all the countries in the world. This country data were compiled last year by the UN custodian agencies who joined forces under the UN Water Integrated Monitoring Initiative for SDG 6, or as we fondly call it, IMI SDG 6. The unprecedented level of reporting is a major accomplishment for us as a global community, but even more so for all the country focal points who are joining us in this webinar. On behalf of UN Water, I would like to thank all of you for your extra hard efforts in monitoring SDG 6 in your country this year, especially in the difficult times we've been all living through. When we look at this data, they sadly confirm the tendency that we first saw in 2018, that we are off track to achieve sustainable water and sanitation for all by 2030. Taking a look at some of the hard facts about SDG 6, we see that billions of people worldwide still live without safe water and sanitation and basic hygiene services. Nearly 10% of the world's population still live in areas with extreme water stress. We know that wastewater is being released untreated into the environment, and 1 in 5 of the world's river basins are changing rapidly, which is exacerbated by changes in climate. We see that sustainable management of water resources remains out of reach for many countries. The data show that in order to meet our goals and targets, we are going to need to accelerate progress, and in some areas up to 4 times faster to be able to meet SDG 6 within the next 9 years. More than anything, we're going to need politicians and policymakers at all levels to be able to set bolder priorities and quickly. But the good news is that we already have a lot of sustainable solutions in place. Last year, UN Water launched the SDG 6 Global Acceleration Framework with the full backing of the UN family to mobilize action across government, civil society, and the private sector across the UN to be able to better align our efforts, optimize financing, and enhance capacity and governance. From our work with countries and from their data, we've learned a lot about opportunities for accelerating. Last year, we still see large data gaps. Our ambition and hope with this data and with our SDG 6 reports are to further encourage and support national and subnational data collection and ultimately help policy and decision makers to take informed action. This is what IMI SDG 6 will be focusing on as we go forward, and we call on the entire water community from global to local efforts to join us in taking this forward. I wish you a very fruitful and lively webinar today and very warmly welcome you to join the Thank you very much.
Okay, and I think we're back now on the agenda. So let's move ahead with the discussion of water, sanitation, hygiene. Just before that, I'd like to give an overview of the targets. You can see that the 2030 Agenda for Sustainable Development sets out a broad array of targets related to water and sanitation, much broader than the MDGs. And there's a global monitoring framework, which is set by the Interagency and Expert Group for the SDGs, or IAG. And that's a working group with representatives from about 30 countries. It's currently chaired by Japan. And each of the targets has one or sometimes a few indicators, and the IAG has identified custodian agencies for each of these.
Rick, sorry, we can't see your slides, just to let you know. We can see the video.
So sorry, let me share again. How about now? Can you see the slides now?
Yes.
Yes, we can.
Okay, thanks so much. So today we're going to be speaking about these three indicators from targets 6.1 and 6.2, and WHO and UNICEF are the custodian agencies for these. The work is implemented through the Joint Monitoring Program for Water Supply, Sanitation, and Hygiene, or the JMP. Let's see now if I can advance. Yes. Now, of course, the SDGs include a number of global targets and indicators related to WASH. So the JMP produces data both on target 6, but also contributes to data on goal 1, where target 1.4 is about universal access for all to basic services, including WASH. And then under goal 4 and goal 3 for education and health, there are also language around the proportion of schools with access to WASH and proportion of healthcare facilities with basic WASH services. Now, national WASH targets are increasingly reflecting these SDG ambitions, aiming to provide universal coverage and reach higher levels of service. However, 5 years on into the SDGs, we see that many countries are still working to balance the global development agenda that they have signed on to with national plans and priorities. And it's important to note that the Agenda for Sustainable Development, as articulated in the Transforming Our World Agreement, recognizes this tension and notes that all of the global SDG targets are aspirational and that each country is expected to set its own national targets, guided by the global level of ambition, but taking into account local circumstances. Now, what the custodian agencies are expected to do then is to maintain global databases, to lead methodological work and develop standards, to contribute to the building of capacity in national statistical systems, and to establish mechanisms for compiling and verifying national data. And all of that leads to providing internationally comparable data and narratives to the UN Statistics Division for entry into the global SDG database and the annual SDG progress report. Besides providing data for the Secretary General's reports, the JMP also produces its own reports, which go into much more detail exploring the data. We produced our first baseline report for WASH in households in 2017, followed by schools in 2018 and healthcare facilities in 2019. And now we update each of these reports every 2 years. So we've just published the 2021 report on WASH in households, which we'll be discussing today. Custodian agencies are meant to develop standards and to work out how to compile and verify national data. And one of the main ways we've done this is to produce, in consultation with countries and with global monitoring experts, a set of core questions and indicators that can be used in data collection, especially through household surveys or assessments of conditions in schools and healthcare facilities. And all of the national data that we then draw upon to produce the global statistics, we summarize in Excel spreadsheets that we call JMP country files, which can be downloaded from our website. And these show all of the data that we've compiled from national sources and how those are used to produce the global estimates. Before we publish any global update, we do go through a country consultation process that seeks to engage all of the relevant national authorities to give technical feedback to the JMP team. We're especially keen to learn if there are any relevant national data sources that we haven't compiled, but we also need to know if any of the data sources we have found should not be used for whatever reason, or if we have not interpreted or classified the national data correctly, which can happen, especially when the data collected use questions or indicators that are not aligned with the global ones. We're preparing now to hold our next consultations on WASH in schools and healthcare facilities at the end of this year to produce reports by mid-2022. Now here's just a quick snapshot of the report we published in July, which drew upon nearly 4,000 national data sets. About half of those came from administrative data and the other half from censuses and household surveys. The global database now includes over 3,000 data sets on drinking water and sanitation, but only about 200 on hygiene, and almost all of those are household surveys. We'll be looking at highlights from the report in more detail, but the main message of the report is that 5 years into the SDGs, it's clear that the world is not on track to meet any of the SDG targets for water, sanitation, and hygiene. And for each of the principal 3 indicators, the data show that the rate of progress would need to be 4 times higher in order to reach universal coverage for all by 2030. So there's a real need to accelerate investments if we want to achieve those targets. The report also had a special focus on challenging situations. We examined the data available about how COVID was impacting WASH, but also looked at WASH in settings that were already fragile before the pandemic. The OECD lists 57 fragile contexts, which are home to 23% of the world's population, and more than 3/4 of those living in extreme poverty in 2020. And what we found was that people living in fragile contexts often have much lower WASH service levels and will need to be a major focus of efforts to accelerate progress towards the 2030 targets. In 2020, people living in fragile contexts were half as likely as those living in non-fragile contexts to have safely managed drinking water and safely managed sanitation services. And they were 5 times as likely to lack even basic drinking water, 4 times as likely to lack basic sanitation, and 3 times as likely to practice open defecation. Now I'm going to pass over to Tom Slaymaker to take us through the section on drinking water, and then we'll have a break for discussion and questions and answers. Tom, over to you.
Okay, thanks, Rick, and I hope you can hear me. So let's start with drinking water, and we're talking about SDG target 6.1 and the global indicator 6.1.1, which is the proportion of the population using safely managed drinking water services. And this is part of a services ladder that we use to benchmark and compare progress across countries. Now, the drinking water ladder has these 5 service levels. So we still track the population using surface water and the population using an unimproved drinking water source, such as an unprotected well or spring. But for SDG reporting, the population using improved drinking water sources are now divided into 3 categories. So if a round trip to collect water exceeds 30 minutes, then we call that a limited service. If it takes no more than 30 minutes, it counts as a basic service. But in order to meet this new ambitious SDG standard for safely managed drinking water services, households need to use an improved source that is accessible on premises, available when needed, and free from contamination. We do also combine basic and safely managed into a category which we call at least basic, which is the indicator that's used for monitoring SDG target 1.4, which is about universal access to basic services. Next slide, please. Now, as Rick said, the headline finding is that the world is not on track to achieve universal access to safely managed drinking water services by 2030. This chart is showing progress between 2015 and 2020. And then you can see the dotted line, which shows you what will happen if current rates of progress continue. And then you can see the very fine dots showing the acceleration that is required in order to get to universal access by 2030. So over these first 5 years, global coverage of safely managed drinking water has increased by just 4 percentage points. That means at current rates of progress, the world will only reach around 81% coverage by 2030, and that would leave 1.6 billion people without safely managed services. You can see that Central and Southern Asia has achieved the fastest rate of progress, but none of the SDG regions are currently on track to meet the global target. And Sub-Saharan Africa has actually progressed second fastest, but it requires the greatest acceleration in order to get to universal coverage. At current rates of progress, it will only reach around 37% by 2030. So globally, we need to see a quadrupling of current rates of progress. In least developed countries, the rate of progress needs to increase around 10 times. And in those fragile contexts that Rick mentioned, the rate would need to increase around 23 times to meet the target. Next slide, please. So these ladders are showing trends between 2015 and 2020 for the world on the right-hand side and for the different regional groupings. You can see that we have estimates for safely managed services for 5 out of our 8 SDG regions. And those range very widely from 30% in Sub-Saharan Africa up to 96% in Europe and Northern America. Globally in 2020, 74% of the population using safely managed drinking water. And that means that we still have 1 in 4 people lacking safely managed drinking water services. And globally, around 771 million still lacked even a basic drinking water service in 2020. 8 out of 10 of those living in rural areas, nearly half of them living in least developed countries. The next slide shows that we have estimates for 138 countries in 2020. So we still have large parts of the world which have insufficient data in order to be able to report on this SDG global indicator. And because we're still missing data for large populous countries, such as India and China, we only have data for around 45% of the global population. And what we find is that data on accessibility, availability, and quality of drinking water are more widely available for middle and for high-income countries. The next slide shows that we can increasingly estimate trends. We can do this for a relatively small number of countries. This figure is showing coverage of safely managed drinking water services along the bottom, and it's showing the annual rate of change along the side. And so you can see that at current rates of progress, only 16 countries out of the 99 countries which have not yet achieved universal coverage are currently on track to reach universal coverage by 2030. So if your coverage is higher, then you need a lower rate of change. If your coverage is lower, you need a much faster rate of change in order to meet the target. And you can see that 69 of those countries are in the yellow zone, so they're progressing too slowly, and 14 of them are in the orange zone. And that means that coverage has actually decreased. So the fastest rate of progress is actually in the Republic of Moldova, 1.68 percentage points per year. But even that will not be sufficient to achieve the target of universal coverage by 2030. Next slide. Now, in order to calculate safely managed drinking water services, we are using the minimum value for accessibility, availability, and quality. And what we see is that these range widely between countries and between countries within the same region. So here you can see the dark dot is accessible on premises, the medium dot is available when needed, and the light is free from contamination. And you can see in each of these regions there's a very wide spread. So for example, if we look at Latin America and the Caribbean, if you look at accessibility on premises, this ranged from just 8% in Haiti to over 99% in 8 countries. Availability ranges from about 26% in Bolivia to universal in Chile, Puerto Rico, and Uruguay. And quality of drinking water, just 43% of the population in Mexico drinking water free from contamination, over 99% in Martinique, Puerto Rico, and Saint Barthélemy. So you can see very big differences between countries within regions. And the next slide shows that for some countries where data are collected through a household survey, we're able to disaggregate all of these different elements for different populations. So we can not only look at the differences between regions and between countries within those regions, we can also look at urban-rural, we can look at wealth quintiles, and we can look at subnational regions. This is an example from Chad, and it shows really big differences between the richest and the poorest. So not such big differences for availability and quality, but very big differences for accessibility, for example. There are also big disparities between the subnational regions on the right-hand side. So for example, you can see accessibility on premises, 69% in Borku, down to just 2% in the Lac region of Chad. So very big inequalities within countries as well. And the next slide is showing some data that have emerged from water quality testing in household surveys. And these are showing that fecal contamination through drinking water is actually very widespread. And in some low and middle income countries, very large numbers of people are using sources with very high risk of contamination. So you can see in this figure, the water free from contamination is shown in blue, and then the very highly contaminated drinking water is shown in orange. And in 6 countries here, in Sierra Leone, Chad, Ethiopia, Kiribati, and Laos, PDR, and Madagascar, less than 20% of the population using sources free from contamination. And in 4 of those countries, more than 40% drinking very high risk drinking water. We're also able to track rates of change in basic drinking water services. We can see these range widely. The vast majority of countries have made progress. And we see that the countries making the fastest progress are usually those with less than 75% coverage. But countries with similar starting points have also fared very differently. So if we take the example of Sub-Saharan Africa, we can compare Mozambique and the Central African Republic. In Mozambique, coverage has increased rapidly, whereas in Central African Republic, it has been decreasing steadily since 2015. And we can also compare coverage amongst the richest and the poorest and calculate the ratio, which is an indicator of inequality. So here we can see that the richest in Somalia, in rural Somalia, are 3.9 times more likely to have basic drinking water services than the poorest. And coverage amongst the richest in urban Madagascar is 4.9 times higher than it is amongst the poorest. So very significant inequalities, even in basic drinking water services. And then my last slide is just to show that the good news is that the population without a basic drinking water service has been steadily declining since 2000. It's been reduced by 1/3 from over 1.2 billion to 771 million in 2020. The number of people without basic services has decreased in all of the SDG regions, with the exception of Sub-Saharan Africa. Eastern and Southeastern Asia has recorded the biggest reduction. But actually in Sub-Saharan Africa, the population without basic services has increased slightly due to population growth. It's increased from 350 million to 387 million. So this means that Sub-Saharan Africa now accounts for half of the global population without basic drinking water services in 2020. The majority of those are living in rural areas. Nearly half of them are living in least developed countries. So those are my slides on drinking water. And I'm now going to pass back to Rick for the discussion and Q&A.
Thanks, Tom. And we've got about 15 minutes now to have a discussion around this question of what progress have we made 5 years into the SDGs, and also what still needs to be done to strengthen national monitoring of SDG indicators for drinking water services. I'd invite any of the participants to either type a question into the chat, or if you'd prefer to speak, you can raise your hand and then we'll be able to unmute you so you can ask your question directly. But just to get the conversation started, I'd like to reach out also to one of our regional advisors who's on the call today, Oliver Schmoll from WHO's Europe region. Oliver, the WHO regional office is doing a lot on this. Could you share with us some of the activities that you're doing, especially regarding drinking water services? Over to you, Oliver.
Yes, thank you very much, Rick. Good morning, good day, good afternoon, everyone on the call. Thank you very much for this very clear presentation, Rick and Tom, on the recent numbers on access to water in households. And Europe, the European region is one of the regions which typically features with very high access numbers for both basic and safely managed, as we could see from the numbers presented. But in our region, we are also covering Central Asia, as well as parts of Southern Asia in the Caucasus, where the numbers actually look much less good. And I think one of the important information that come out of the JMP mechanism is really that they help us to understand the inequalities across countries and within countries in terms of divides between urban and rural population groups, but also divides between the rich and the poor people in the region. And in fact, the realities that we see emerging from within these countries in terms of access to drinking water, basic and safely managed, really require a lot of attention in our region still. To improve these realities, in the European region, I think we have the unique situation that we have a legal instrument at hand, which is called the Protocol on Water and Health, which is jointly hosted by the United Nations Economic Commission for Europe and the WHO Regional Office for Europe. And this legal instrument, once a country signs up to it, is legally obliged to set national targets to improve the situation in water, sanitation, hygiene, and health matters. And indeed, many countries in the regions that are parties to the protocol have set targets towards improving access to safely managed drinking water services. These targets take different forms, for example, in improving compliance rates to certain parameters, or also may take the form of committing to adopt frameworks like the WHO recommended water safety plan approach to improve drinking water quality in their respective countries. So in other words, the Protocol on Water and Health helps countries to translate international commitments that come from the 2030 agenda and the commitments, the calls made by SDG 6, to translate them into national action, stepwise action, and how countries can reach the calls of SDG 6.1 in the national context, and to define incremental progress towards achieving these commitments related to SDG 6.1. On the same hand, the protocol also offers or requires countries to report on progress. So after every 3 years, the protocol invites parties to the protocol to report on what they have achieved in terms of progressing with access to basic and safely managed drinking water services. And indeed, these numbers also feed into the JMP mechanisms and are one of the sources that are being used in compiling the global JMP report. I wish to highlight that the protocol, specifically under the protocol framework, we are also working in several areas that help countries in strengthening their efforts towards reaching SDG 6.1. Let me take 2 examples. The first example is national uptake of water safety planning approaches. So if you really want to reach safely managed services, according to the letter presented by Rick and Tom, we need to establish frameworks, both regulatory frameworks, but also monitoring frameworks that support achieving such safely managed services. And the best way of doing so is to adopt a risk-based framework, which is described by the WHO guidelines for drinking water quality through the water safety planning approach. So a lot of investment is being made through the protocol mechanism to build capacities in countries to establish regulations that are adopting water safety planning principles, but also building capacities among operators and surveillance agencies to implement water safety planning principles. Only if we have these kind of frameworks in place at the policy level and at the practical level, I think we can push in the long term for achieving safely managed services as defined by the JMP framework. The second example is indeed that the protocol has established also a so-called equity scorecard, which is a tool for countries, but also for regions in countries, or even cities and communities in countries, to undertake a self-assessment of the inequalities, prevailing inequalities in a country. So the equitable access scorecard helps decision makers to understand geographical disparities and differences in access to or quality of services, but also to understand social disparities and economic disparities in terms of access to drinking water, sanitation, and hygiene services. And it's really a tool that helps countries to drill into these specific situations in different settings in the country, and to understand which people are marginalized or left behind, and to identify specific measures that help them to boost access to drinking water services, either basic or safely managed. So that scorecard is an important, if you wish, concrete implementation tool that follows the analysis, the broader analysis of the JMP figures, and offers countries a tool to act upon them. Using the data from JMP and using the scorecard as a follow-up instrument to identify gaps, identify actions, and to act upon them. So these are 2 examples, the water safety plans and the equitable access scorecard, that can provide practical support and tools to countries to get better and to move upwards the ladder as presented by the JMP. I think this is it from my side, Rick, and over to you.
Thank you so much, Oliver. It's always inspiring to hear about the work in the region, and you have this great institute of the Protocol for Water and Health, this institution that is a really nice example of localizing the SDG ambition into national targets. And that's one of the things that is often confusing, or there's some lack of clarity about. I had that slide about how the global targets are ambitious, but also aspirational. And these are nice examples of countries within the protocol setting targets that might have different indicators. There are a lot of elements of water safety that aren't part of the SDG framework. We see countries that set targets for things like non-revenue water, or countries for whom 100% safely managed drinking water is simply not a realistic target within the SDG timeframe. And it's important to realize that it's okay to set targets that are not 100% if they reflect the national circumstance. But what is important, more than the specific target, is to make sure you have in place plans to increase coverage as much as possible. And your example of adopting water safety plans is something that definitely can be done in a range of countries, even if you don't have a regional program like the protocol. Thanks also for the example of the equity scorecard. And if you could put the link to that in the chat, I think a lot of people would like to see that tool. We've had a couple questions in the chat, and I see some people have raised their hands. First, we have a question in the Q&A. I'm going to call on Tom to answer, and that is, how could we explain the reason that we see decreasing progress? And this was on, I think, basic drinking water services in 14 countries. Tom, over to you.
Yeah, I think this is a good question, and one of the challenges we have when it comes to monitoring these new SDG indicators is trying to find sufficient data to estimate trends. So, for example, if we only have 1 or 2 data points over the 5-year period, it can be quite difficult to determine whether what the rate of change is and whether the trend is positive or negative. But for a growing number of countries, we can do that. Almost all countries have estimates for the basic level of service, so we're pretty confident about the trends in basic services, and a growing number have estimates for safely managed services. And what we're seeing as a general pattern is that the coverage tends to be higher in urban areas, and it tends to be lower in the rural areas, but the rate of change is faster in rural. And in many urban areas, the rate of change is slower, and in some urban areas, it's actually decreasing. And so that suggests that it may be due to population growth and to do with rapid urbanization, which of course is a characteristic of many low and middle income countries. But the other big factor, which Rick highlighted in his presentation, is fragility and conflict and natural disaster. And so some of the countries which we've highlighted in the report are countries which have been affected by conflict over the past 5 years, and that has led to a deterioration of service levels. And one of the questions, of course, is how can we support countries to keep services running during a conflict or during a natural disaster in order to minimize the impact on vulnerable populations. So that's something that we've tried to highlight throughout the report, is the fact that fragile countries are particularly vulnerable, and a lot of the efforts required to achieve these global targets will need to be concentrated in those countries in future. Thanks, Rick.
Thanks, Tom. Now I see we've got a raised hand from Bobby Whitfield. Bobby, I've unmuted you. Can you go ahead and introduce yourself and share your comment or question?
Thank you very much. My name is Bobby Whitfield. I'm Chairman and CEO of the Wastewater, Sanitation and Hygiene Commission here in Liberia as the principal government entity in all things wash. My question is really whatever happened to the Global Acceleration Framework that was launched a year ago. We heard about this, thought it was really great. It was going to help, with accelerating, progress within the sector. Those accelerators identify financing, data, information, capacity building, innovation, and governance. But since then, nothing. We have not heard anything, and nothing that we really specifically said during the launch of the Global Acceleration Framework was that the UN system was going to send a country coordinator or resident coordinator in country to help government or country with this particular acceleration. But nothing has been done, and we are here again talking about the decrease in progress in countries like Liberia. When we talk about Africa, Liberia is one of those countries that is really struggling with our reporting system. We don't have the support, and we don't see how the UN system is helping.
Okay, thanks, Bobby. I see the audio quality wasn't great, but we understood your point that there was a lot of noise around this global SDG 6 acceleration framework. But from your position on the ground in Liberia, you're not seeing changes. You're not seeing the UN providing coordinated leadership or additional funding to affect change. I think this relates to also one of the questions that was in the chat about how funding could be increased, or how countries could be encouraged to increase the required investment in drinking water and sanitation services, especially in least developed countries. And I mean, the thing about the SDGs is that they are voluntary commitments that all countries have taken on, and that global development partners have agreed to support and make part of their programming. So I think there's not one specific example of how that commitment can be translated to action at the local level. But the acceleration framework does lay out specific activities, whether it's around human resources or governance or financing or data, that can be done to achieve acceleration. So I think every indicator report is a new opportunity for advocacy at the national level to take stock of the current situation, and if the current activities are not commensurate with the level of ambition in the SDGs, and that was one of the main messages of our 2020 report, then that provides strong evidence to advocate that governments and development partners both step up and increase their support to WASH. And that can certainly be increases in financial planning, but also more other things besides finance, investing in human resources, investing in training, doing the long, hard work that Oliver mentioned about building and establishing regulatory frameworks and making sure that tools like water safety plans are mainstreamed. It's all a long road, and I think we all have a role to play in advocating for those types of activities to happen, especially those of us who have strong presences at the national level. With that, I think we're a few minutes over our time, but it's been a good discussion. And I'd like to move on next to the section on sanitation then. Let's see. And I'm sure we'll come back to some of these same issues in the discussion that'll follow this. So for sanitation, we have a service level ladder, much as we have for drinking water services that Tom explained earlier, where we have 5 rungs, where we'll continue to track, as we have since the establishment of the MDGs, the population practicing open defecation, who have no sanitation facilities at all, and those who have some kind of sanitation facility, but it's not really well engineered, it's not improved. We call that unapproved sanitation. And then the technologies that are considered improved, whether that's a sewer connection or a septic tank or a pit latrine with slab and basic engineering protection, those are divided into these 3 categories of limited, basic, and safely managed services. So any kind of improved facility at all that's used and is shared with other households, we classify as a limited sanitation facility. I'm sorry, a limited sanitation service. Now, if that same facility is not shared, then that counts as a basic service. But to reach the new SDG indicator of safely managed services, we look at more than just, is it an improved facility that's not shared, but what actually happens to the excreta that are deposited or flushed into that facility? Are they managed downstream at all? So the excreta should be either safely treated and disposed of on site through some kind of local treatment system, like a septic tank or a pit latrine, or removed and treated off site. And here we can think about piped sewerage and centralized wastewater treatment plants. Now, the SDG progress update from 2021 shows that many countries still don't have sufficient national data to report on the SDG global indicator, especially because of those new requirements for information about treatment, whether it's on-site or off-site. But in 2020, there were national estimates available for 120 countries, areas, and territories. and that represents 81% of the global population, including India and China, shown in yellow here. And one thing that we found is that most countries have data on treatment of wastewater from households connected to sewers, but very few countries have data on the treatment of waste from septic tanks and pit latrines. So that remains a major data gap going forward. If we look at the regional picture, we can see that we have SDG estimates for for safely managed sanitation services for 7 out of the 8 SDG regions. We also have them for least developed countries and landlocked developing countries. And at the right, you can see that the global picture progress has increased from 47% to 54% between 2015 and 2020. Of course, that still leaves nearly half of the world's population, 46%, without safely managed services in 2020. Looking at the different regions, you can see a range of coverage levels and also rates of progress, with some of the most rapid progress taking place in Eastern and Southeastern Asia. But if we take those rates of progress and project them forward to 2030, we can see that at the global level, the rate of progress that brought us from 47% to 54% would only reach 67% by 2030. So that would leave a third of the global population without safely managed services in 2030. The region that has the fastest growth rate, that again was that's Eastern and Southeastern Asia, even they are only projected to reach 80% by 2030. So there's no SDG region which is on track to achieve universal access to safely managed sanitation by 2030. If we look not at regions, but at countries, we can see that only 8 out of the 109 countries where we have data both on coverage and trends are on track for universal coverage by 2030. We have Iceland as one of the high-income countries that is on track. China has a very high rate of progress, over 2 percentage points per year. It's the highest in the world, but because their coverage was lower, they're almost but not quite on track for universal coverage by 2030. And you can see that many of the countries that are low income or lower middle income countries, shown as circles or triangles, have much lower coverage and would need to have much higher rates of progress to achieve universal access by 2030. And again, there are about 20 countries where coverage is actually decreasing. That could be for any of the reasons that Tom mentioned that apply to drinking water services, having to do with urbanization or fragile contexts or investments in infrastructure that haven't been sufficiently maintained. So we see sometimes infrastructure that's put in isn't sustainably used going forward. Now, one of the findings in this report that I think was new and interesting is that for the first time in 2020, more people globally used improved on-site sanitation facilities than used sewer connections. So that means people with septic tanks or improved pit latrines are growing faster than the population having access to sewer systems. And of course, that has big implications for how those wastes can be safely managed. If we look at the regional level, also, we see that the distribution of on-site and sewered sanitation varies widely. Actually, at the global scale, they're quite even. There's about 43% of the population with sewer connections, that's the dark green on the right, and 43% with improved on-site sanitation. Not surprisingly, if you look at the distribution in urban and rural areas, you see much higher coverage of sewered sanitation in urban areas and much higher coverage of on-site sanitation in rural areas. And then if you look at the different SDG regions, you see that the regions that have high numbers of countries with high incomes, Europe and Northern America, Australia and New Zealand, also Latin America and the Caribbean, you see a real predominance of sewered sanitation. But even in those regions, there are significant populations in rural areas or small communities where on-site sanitation is important. And even in those regions, there are big data gaps about how well the systems are maintained, what happens when a septic tank or a pit latrine is filled, does it get emptied, does it get safely removed, are the excreta taken to an appropriate treatment plant and treated. All of those are challenges for monitoring in the SDGs with this new safely managed sanitation indicator. But data systems are improving. In household surveys, there are now more and more questions about how people manage their on-site sanitation systems. Have they been emptied? What's happened to the wastes once they have been emptied? And you can see these two charts show that the majority of septic tanks and pit latrines, septic tanks are the dark green circles, improved pit latrines are the lighter green squares. The majority of them are often not emptied, and especially in rural areas. These scatter plots show urban areas on the horizontal and rural areas on the vertical. So you can see it's much more common for on-site sanitation facilities to not be emptied in rural areas. And if you look at some countries like Mongolia, Gambia, and Niger, septic tanks are almost never emptied in rural areas, whereas they're more commonly emptied in urban areas. But if we look on the right, we see that in many countries, wastes are emptied and removed offsite, and that happens predominantly in urban areas. It's not surprising. This is where the wastewater treatment and sanitation facilities are. But if you look at China, Mongolia, Gambia, you can see very high rates of emptying and removal offsite in urban areas, but much lower in rural areas, even when people in rural areas are having septic tanks or similar technologies. Now, if we consider centralized wastewater treatment, we see that there are more data on that. Countries tend to have information about wastewater treatment plants, but that the level of treatment varies widely by SDG region. Now, for the SDG indicator, we consider that a treatment plant that gives secondary treatment or higher levels, tertiary treatment, for example, that counts for the safely managed indicator. But the more basic treatments, primary treatment, which is really just solid separation, that wouldn't count for safely managed services. But you can see in all of the different SDG regions, even Eastern and Southeastern Asia, Europe and Northern America, where the average values are highest, there are still countries, individual countries, that have 50% or less of their wastewater treated even to secondary levels. So I said that there were challenges for on-site sanitation. There do also remain challenges for centralized municipal wastewater treatment plants as well. And you can see that in some regions, if we look at Latin America and Caribbean, Central and Southern Asia, or Sub-Saharan Africa, there's a lot of centralized wastewater that's collected is not treated with secondary or higher processes. If we turn then to basic sanitation, we see that the number of people without basic sanitation services has been decreasing in all regions, except for in Sub-Saharan Africa and Oceania. And this gets back to that question of population growth, in particular in Sub-Saharan Africa, where you see that the advances in service are just not keeping up with the population growth. And that happens both, especially in urban, but also in rural areas of Sub-Saharan Africa. However, if you look at Central and Southern Asia, if you look at Latin America and the Caribbean, Eastern and Southern Asia, Southeastern Asia, you do see important decreases in the number of people without basic sanitation services. Now, the people without basic sanitation services, they also include those who have no sanitation services at all and practice open defecation. And that is still the case in 55 countries where more than 1 in 20 people still practiced open defecation in 2020. There's a heavy concentration in Sub-Saharan Africa, but all throughout Asia and even in Latin America and the Caribbean, we do see significant populations practicing open defecation, particularly in rural areas. If we look at the inequalities within regions, within countries, drawing on that kind of household survey data that allows us to know about the characteristics of the households, we see that if we look at Sub-Saharan Africa, there's a very wide range of countries with regard to open defecation. In some countries, there's basically none. In others, it's more than 60%. But in Madagascar, 42% of the population practiced open sanitation. Big differences in rural areas, but even bigger differences among the richest, where it's a very rare practice, and the poorest, where about 2/3 of the population still practiced open defecation. Then if we look at subnational regions, we can see that the Analamanga region, which I believe is where the capital is, has the lowest coverage, but then Ihorombe region has very high rates of open defecation still being practiced. So this is my last slide. I'm going to turn it over now to Tom to facilitate the question, which is the same basic question that we had for drinking water services. Tom, over to you.
Thanks, Rick. And I'd just like to encourage participants to type their questions about sanitation into the chat box. Or if you'd like to make a point, then raise your hands and we'll come to you. Rick, there's already a question to you about community involvement in reporting information on water leakage and contamination incidents. So maybe you could have a look at that one. But in the meantime, I'd just like to start by turning to Évariste. Évariste Kouassi-Komlan, who is our UNICEF regional advisor for East Asia and Pacific region based in Bangkok. And Évariste, you've been working on trying to address some of the SDG data gaps in your part of the world. I wonder if you could just give some reflections on the progress that's been made and what you think still needs to be done in order to improve national and global monitoring and reporting on the SDGs. We can't hear you, Évariste.
Can you hear me, Tom?
We can hear you now. Go ahead. Okay,
perfectly. Good morning, everybody. I'm happy to join you again during this webinar, and I'm very excited to see a lot of progress and also how the clear presentation from Rick on sanitation as well, and thank you very much for that. I just want to focus on more on how we have worked together to support most of the country in the region to improve or to close the data gap for the monitoring of SDG 6, particularly 6.2. So the data that Rick presented show a lot of progress in East Asia and Pacific. I'll focus on East Asia and Pacific. With the actual trend that we are having in the region, the estimate population to have civilly managed by 2030 will be 79% of the region, which is making the challenge that will be totally you are not going to reach SDG 6.6 if we are at the same trend. So in March 2019, we have had in Bangkok a sort of regional workshop with all the country and set up some of orientation how we can support most of the country to improve the data gathering and also to close the data loop. So some of the countries have developed a clear action plan. Those countries include Myanmar, Cambodia, Indonesia, where a clear pathway has been defined basically to support the National Institute also of Statistics also include the GMP questionnaire into household survey, census survey, and also wherever possible, where we are conducting multiple indicator closer survey to have all those 6.2 and 6.1 indicator included. I just want to focus a bit on some of those lessons learned in the region. The first one is having the questionnaire from GMP ready provide a good opportunity basically to influence the way that the data can be collected at the country. I think it's very useful the work that GMP have done, providing a set of questionnaire to support the country, which is fundamental. The second lesson learned is all those existing national survey mechanisms that are there. There's the good there's a good opportunity for us and also for many partners to interact easily with them, because we have a product, we have a questionnaire in hand, and then this, this influence has also be supported by the team of GMP, which is a very good thing. And wherever possible, there are also some funding support that is attached to that. And we appreciate all those support from GMP, basically helping those kind of system in place. And then the third one, which is more the challenge that we have when supporting the country to have those new questionnaire in those method survey. One of the challenge we have is the length of those questionnaire. Basically, some of those institute, they always came back to us and say, you have too much questionnaire. How do we, bringing them down? So those are some of the lessons learned during the whole process we have experienced so far. So I just want to put one point as we are moving forward. There's a lot of initiatives that have been going on in the region. One particularly on water quality monitoring by Sydney University, which is very important. And the methodology have been developed. This also linked to what our colleague from WHO in Europe was saying earlier on water safety planning, and also how we include some of the components of sanitation safety planning when we are addressing sanitation issue at the urban level as well as in rural level. The second point I just want to push before I conclude is that although we do have a different challenge in most of the country to make sure that we include those questionnaires, some of the country are very receptive to make sure that we disaggregate those data very quickly so that we can have a better planning process and to achieve the SDG target. So in conclusion, from my point, good progress has been done in terms of achievement, but in the same time, we need to close the data gap in the region, which is very important. The second point is many countries have made a significant effort basically to include the questionnaire and need further support to keep the momentum in the year to come. And then the last one is that although we are advocating to include for the inclusion of those data in the national monitoring system, we need to make sure that appropriate support is given to those institutions as well in the region. Thank you very much, Tom, and pleasure again to contribute today.
Thanks, Everest, and great to hear about the work you're doing and the emphasis on providing technical guidance, but also working closely with the National Bureau of Statistics to try and integrate these indicators into routine data collection systems. And of course, it takes time, and there are lots of demands on the statistical system, and sometimes the questionnaires are already too long. So yeah, it's a long process, but great to hear that you've been making some progress, and also to make the link between the work that's been done on sanitation and the work that's being done on drinking water. And in many cases, these can be done hand in hand. I'd like to ask Rick to respond to the two questions that have been typed into the Q&A from Valiapan, and perhaps also from Dr. Kabamba, Rick. And then I'm going to turn, I see one of our attendees has a hand up. So could you go quickly, Rick, and then I'll bring in Abuagla.
Sure, thanks, Tom, and thanks for both of these questions. The first question is about how the involvement of the community in the data collection for SDGs, or what about the involvement of community, especially regarding water leakage and contamination incidents. And I think while the question is more about water, it applies equally to sanitation. If we think about water with this new element of drinking water quality and water being safe to drink, that relies on data that comes from water quality surveillance, and often surveillance is driven by customer complaints. So there's a direct channel for people to say there's something wrong with my water supply that triggers actions by the authorities. Now, the service providers, you can never test everything before the water is delivered, And instead, what we promote is what Oliver was mentioning, is this risk management approach called water safety planning or sanitation safety planning, to identify things that could go wrong and put in place control measures before they go wrong. But one important part of water safety planning and sanitation safety planning is having feedback loops and having mechanisms where consumers can give their feedback, where the operators are doing frequent operational monitoring. And these can apply for big formal systems, but also for smaller informal systems or community managed systems. I think both Oliver and Eva talked about the importance of having some oversight authority, like a regulatory mechanism. That's another tool where people can voice their complaints if services are not going well, if there's some water leakage or something. That could, again, trigger some oversight action by the authorities. I think there is increasing interest in technologies, in sensors, in real-time monitoring systems, in apps where communities can directly make inputs. And those are interesting and promising. I think they're still developing. One challenge is that if you make a mechanism for people to highlight a problem, there also has to be a mechanism in place for the authorities to receive that and to take timely action. So we've seen cases where a nice app has been built, people have said the water point's not working. If nothing happens, then they get discouraged and the system doesn't work well. So I think that type of system can work, but it needs a full systems approach. And if those type of data were to be used for SDG reporting, they would really have to be integrated into national systems as part of the national statistical systems, and ideally in collaboration with the national statistic offices, because they're the guardians of the SDG data. For the second question from Dr. Kabamba about how the JMP thinks that states can be influenced to take decisions, concrete decisions to improve drinking water quality, and citing that Dr. Kabamba sees a big disparity between access to water and the quality of water. Well, this is the whole step from the MDGs to the SDGs. This is raising the level of ambition, and countries have signed on to the SDGs and the 2030 Agenda for Sustainable Development, where we're talking not just about access to physical infrastructure, but to the quality of services. So that does imply doing things a bit differently. It implies building up those systems of oversight, of regulatory oversight, making sure that someone is checking water quality, or more importantly, checking the risks that could lead to problems with water quality through something like a water safety plan. We do see countries adapting water safety planning approaches into their national guidelines and requirements. So I think that's one big step forward. But I think this is for each country to figure how they can up the level of ambition and worry not just about access to water, but also making sure that the quality is good. And let's see, Tom, I see there's another question that's just come in. Maybe though we could go to the participant who's got their hand raised and then come back to Jérôme's question.
Thanks, Rick. Okay, so I'm going to unmute you, Abu Wagla. Can you speak? Okay, so I can see Abu Wagla has a hand up, and I have tried to unmute, but I cannot hear you. Maybe you could try typing your question in the chat instead, and we will respond. So let's turn to the last question from Jérôme, asking about how do we reconcile access to drinking water supplies with the wider stresses on water resources and the availability of water, not just for drinking, but for other purposes. So there are certain parts of Africa, for example, where there is pressure on groundwater, which is being used for agriculture and other purposes. This is a really good question, and one of the objectives of the Integrated Monitoring Initiative for SDG 6 is to bring together the data that we have in the JMP on drinking water availability with the data that is being collected, for example, under SDG 6.4, which is about water stress, and try to see if there is a relationship between water stress and the availability of groundwater and the quality of ambient water quality and the quality of water that people are drinking and the availability of drinking water. At the moment, we haven't been able to do that. We will be putting together these data to see if there is a relationship, but based on the countries where we have already been working, there is not necessarily an automatic relationship between the overall availability of water and the availability of water for drinking. It will depend on many things. It will depend on whether drinking water is given priority. It will depend on how well the existing water resources are being managed, whether they're being managed efficiently. And many countries which have only limited resources are still able to manage them well and to provide services for their populations. Others which have abundant water resources still have problems accessing drinking water. So the relationship is complicated, but it is something that I think we want to analyze when we put together the data that is being collected by the other agencies under the Integrated Monitoring Initiative. With that, Rick, I'm going to turn back to you and ask you to present on hygiene.
Thanks, Tom. And just one more note on this link between drinking water and water resources is that there is the SDG target around water resources management, and there's indicator 651. They had a webinar earlier today, but they're having a second one later on in the day. So we'll see if we can put the link to that in the chat so that those who are particularly interested in water resources could hear from the indicator team there. But now, if we turn to hygiene, we were all really happy at the start of the SDGs that hygiene was included in the SDG framework because it was completely lacking in the MDG framework that was recognized as one of the big deficiencies. So the indicator that was agreed here was, it's a proxy for hand washing practice. It's called Basic Hygiene Services, defined as having a hand washing facility with soap and water at home. Now, if a family has a hand washing facility at home, but it lacks either soap or water, we classify that as a limited hygiene service. And then the families or the people with no hand washing facilities at all are counted as having no facility. So the first global baseline for this one came out in 2019, and we've just updated it. We now have data for 79 countries. And most of the data on hand washing come from household surveys that are mainly conducted in low and middle income countries. The high income countries don't have as many household surveys. And when they do, they typically don't ask about water, sanitation, or hygiene because they assume universal coverage in those settings. So the 79 countries, areas, and territories that we have data for, they represent just over half of the global population. But you can see from the map that most of the data are available in Sub-Saharan Africa, where coverage rates tend to be lower, and through Asia, and a little bit in Latin America and the Caribbean. So the hygiene service ladder shows that basic hygiene services level in purple, and you can see that for 4 of the SDG regions, we have estimates going back to 2015. So we can look at trends and see that in Central and Southern Asia, in Northern and Africa and Western Asia, there are notable trends, whereas in Sub-Saharan Africa and Oceania, things seem to be a little bit flatter. And also the coverage is lower in those regions, with about 1/3 of the population having no hand washing facility at all in the home. We find that coverage of hygiene services is higher in urban than in rural areas, but a lot of regions still lack data. And here you can see that sometimes regions will have data for rural areas, but not for urban areas, just because some of the household surveys are restricted to rural areas. Still, it's clear that, that coverage is higher in urban than in rural areas. And even at the global level, we have global statistics for rural areas, but not for urban areas yet. If we look at the rates of progress, we see actually there is one region, Northern Africa and Western Asia, which is on track to achieve universal access, that's greater than 99%, to basic hygiene services by 2030. That's actually the only region and indicator that's on track to be met by 2030. If we look at the world, though, the world would be on track to reach about 78% basic hygiene services by 2030. So almost 1 in 4 people still unable to wash hands with soap and water in the home by 2030. But really, the coverage is so much lower in Oceania and Sub-Saharan Africa, and the rate of progress would need to increase really tremendously in order to reach universal access by 2030. If we look a little bit in more detail at Sub-Saharan Africa, some of the surveys ask questions not just about, do you have a hand washing facility, but what type of hand washing facility do you have? And we find that a lot of people in Sub-Saharan Africa especially use mobile devices for hand washing. Those are the ones shown on the left side there in the light purple. And in many of the countries where there's data on both mobile devices and fixed devices, shown in darker purple, it's much more common for people to have mobile devices. Now, some of the earlier surveys that we have access to didn't collect this kind of detailed information, or actually only looked for fixed devices. So for instance, in Liberia, there was a survey in 2013 that found that only 2% of people had hand washing facilities in the home, but they were specifically looking for fixed devices. And we think that if there's another survey in Liberia in the future that asks about mobile devices, we'll see a more realistic picture showing that more families do have access to hand washing facilities, but they're often mobile. Another thing we see is that many households have hand washing facilities, but lack either soap or water. And this graph just shows in purple the households that have hand washing facilities that also have water and soap in purple, but the ones that have water but no soap are shown in yellow. Light orange is the ones that have soap but no water. And then the darker orange is households that have neither water nor soap. So you could imagine different types of interventions to increase basic hygiene services in rural areas, depending on if water or soap is the limiting factor. And we do see that it's uncommon for households to have soap, but not water. So probably soap is more of a limiting factor, at least in these rural areas. We also see that water tends not to be the limiting factor for having basic hygiene services. We see many people have drinking water on premises. That's shown on the x-axis. That's part of the safely managed drinking water indicator. But they don't always have basic hygiene services. So if you look at Bolivia, over 80% of the population has water on premises. So that is not a limiting factor. But only about 20–25% of the population has basic hygiene services. So in this case, it's really a lack of soap that's the issue. However, there are cases, fewer cases, but if you look at Mongolia, you see that having drinking water on premises is actually not very common at all. This is low population areas, but still the great majority of people do have basic hygiene services. They do this by bringing water into the home from off premises and storing it and having soap available as well. If we look at gaps between the richest and the poorest, we can see big gaps between rich and poor for basic hygiene services. If we look at the national level, the ratio of the richest to the poorest ranges from 7 to 18 in these countries shown here. And the disparities are even greater at the urban and rural levels. So in urban Liberia, we see that the richest quintile, the richest 20%, are 32 times more likely to have basic hygiene than the population in the poorest quintile. And that's because in the poorest urban populations, coverage is very, very low with basic hygiene. So, less than 1 or 2% in some of these cases where you have these big inequalities between the rich and the poor. And in fact, if we look at the bottom of the hygiene ladder, those who don't even have hand washing facilities at home, whether they have water or soap or not, you see that there were 28 countries where at least a quarter of the population had no hand washing facility at all in the home in 2020. Many, but not all of them, are in sub-Saharan Africa. Some of them, I mentioned Liberia earlier, could be because the data that were collected didn't include mobile devices. So we might expect to see some of these numbers being a little bit decreased, for instance, in Rwanda, if we had better data. But still, it's clear that there are many countries where it's just impossible for people to wash their hands in the home. And the last year really brought this into the limelight of how important it is for people to maintain basic hygiene to control spreads of diseases, including COVID-19. So now I'm going to open up the floor again with the same question about what progress has been made, what still needs to be done to strengthen national monitoring of SDG indicators for hygiene services. And I'm looking to see if we have any chats in the, or any questions in the chats, or anyone who's raised their hands. I'm not seeing any, so I invite you to take this opportunity to share your comments or your questions about the hygiene indicator. One question I might call on Oliver, actually, because in the Europe region, this is one of the big data challenges that we face, because these high-income countries don't collect data in household surveys about basic hand washing practices. And we get complaints during those country consultations when Sweden says everyone in Sweden has hand washing facilities with soap and water at home. Please, correct our entry from insufficient data to 100%. And we have to say, I'm sorry, we can't do that because we need to have some data that supports that. Maybe it's true in Sweden that almost everyone does have soap and water in the home, but it's certainly not true in all countries, and it's not even true in all high-income countries. There are tools like the Equitable Access Scorecard that highlight some populations that lack access to even these basic services, but we're still trying to find ways to find proxy indicators or other ways to fill this gap for hygiene in high-income countries. But Oliver, can I put you on the spot here and see if you had any thoughts about monitoring the hygiene indicator in high-income countries and in Europe?
Thank you for putting me on the spot. Well, you quite rightly described the situation that several countries would not proactively collect data on this, and I think they typically would refer to existing regulatory frameworks and the requirements that would describe the need for presence of such facilities. So I think we probably will see in the near future a little bit of a change here with the Hand Hygiene for All global initiative that WHO and UNICEF have put out, and we have been starting discussion in the region on how we can actually also work with higher income countries to see on how we can make this culture of hand hygiene in all settings a reality. And I think that probably these kind of conversations that we are going to have in countries may also trigger understanding for the need of a proper data to describe the situation in terms of access to hand hygiene facilities. So that's perhaps at this stage more a vague hope than anything else, but I think that this kind of initiative is a good point of entry for having discussions at country levels to look more carefully into the situation. So that's perhaps what I can offer here today. Rick, back to you.
Thanks, Oliver, and thanks for bringing up the Hand Hygiene for All initiative, which was launched just over a year ago by WHO and UNICEF in response to the COVID pandemic. I think one thing that we've found through the Hand Hygiene for All initiative is that, well, water, sanitation, and hygiene are all kind of a mix of, you need hardware, but you also need software, you need behavioral change approaches to to have people using systems properly and sustainably. And I think historically there's been much more focus on the behavior change and the psychological side for hand washing, but you also need the hardware as well. So if you don't have water that's nearby, it's an incredible challenge to have basic hygiene services. So there's interest in, well, what is the blend of promotional activities and support to infrastructure development, whether that's getting water closer to people or promoting hand washing facilities. There's interest in aspirational, nice hand washing stations with mirrors as ways to nudge people to practice hand hygiene more sustainably in the home. And of course, the same applies to schools and healthcare facilities. It's not just having the promotional materials, it's having access to the facilities, it's having a whole culture of hygiene available. Let's see. Tom, please go ahead.
I'm going to bring in Francesco Matisse, who is another member of the JMP team, and then I'm going to try and turn to Bubazan, who says he has a question. Francesco first.
Yes, good morning, everybody. I just wanted to add something about lack of data for high-income countries. We have this problem for hygiene, and we start to have this problem sometimes also for water sources. We have a rule in JMP that if you have an estimate that's more than 99.5%, we extrapolate the estimate until the last available year. There are some countries not having water improved more than 99.5%, and their estimates are based on a few data sources that are very old. So in the last update, we were obliged to turn this country to what we call only total country file, to calculate only a national estimate and losing the urban and rural estimates, because these things are not asked anymore in the censuses and in the household survey. Over.
Thanks, Francesco. It's a good point. When we have very old data, at a certain point, we can no longer use it to make estimates. So we need to continue collecting, especially countries which have had a very high level of service in the past may not be able to maintain that level of service in future. So I'm going to try and allow Bubazan to talk. Can you speak up?
And we might need to ask for the translator's assistance here because as panelists, we can't hear the translation channel. So I wonder if the Russian translator could perhaps type a summary of the question into the chat if we're not able to hear the question in English. But first, Bubazan, please go ahead with your comment, your question.
Здравствуйте, коллеги. Я не знаю, мой вопрос, кому будет обращаться, потому что я пыталась до этого, что-то у меня не получалось, когда Оливер еще выступал. По поводу критерия оценки доступа населения к чистой питьевой воде. Как известно, у нас разные службы работают в этой области, и у всех разные оценки, разные критерии. Поэтому часто возникают у нас разные цифры в одной же стране по доступу населения к питьевой воде. Поэтому я хотела узнать, может быть, вот 2 года уже мы не встречаемся очно, мы когда очно встречались, тоже эти вопросы поднимались. Может быть, есть уже какие-то разработки, если есть, хотелось бы, чтобы вы поделились. И второй вопрос, да, водоснабжение, санитария, гигиена очень взаимосвязаны. И, конечно, она больше как бы критично получается в случаях чрезвычайных, да? И хотелось бы узнать, есть какие-нибудь стандарты, применяемые при оказании помощи в случае таких чрезвычайных ситуациях? Если есть такие стандарты, тоже хотелось бы посмотреть, потому что мы сейчас планируем, потому что последние события, которые у нас произошли, показал, что у нас нету таких единых стандартов, чтобы обеспечить население, которое оказались в таких случаях, той же чистой водой, той же санитарией и той же гигиеной. И поэтому у меня вопрос, может быть, в каких-то странах есть такие стандарты, или я вот искала на сайте ВОЗа тоже, но везде пишут, что достаточным должен быть, достаточно близко должен быть, достаточно обеспечен должен быть. Вот конкретных таких минимальных даже стандартов я не нашла. Спасибо.
Good, and thank you for those questions. I think they're very good questions. So I think the first one was about the coordination that needs to happen at a national level in order to come up with national estimates. So the job of the JMP is to compile national data in order to produce internationally comparable estimates. But in many cases, there is a discussion at the national level about which data should be used, the data from the health ministry, from the water ministry, maybe they're using different definitions. So very often, when we have a country consultation, in order to try and get the most recent data, there is a discussion and there is a debate about which data should be used. So that coordination is very, very important at a country level. And coming up with harmonized definitions across the different parts of government is a very important first step in order for us to be able to make a comparison across countries. And in some countries that works very well, in others it can be very difficult. And then on your second question about emergencies, there are standards for the provision of services in emergency settings. There are standards which were developed by the UN, which are called the SPHERE standards, which set out the minimum service delivery requirements in an emergency setting. But those are very basic level of service. It's purely about providing services to displaced populations in refugee camps in order to minimize the impact of conflict and natural disaster. But we can share those with you, and I'm sure those are also available in Russian. So with that, Rick, I think in the interests of time, maybe we can move on. And maybe you could type an answer to Daval about wet and dry sanitation technologies.
Excellent. Yeah, please go ahead, Ben Tom, with the menstrual health section. Let's see.
Okay, thank you, Rick. So in our most recent update, which was published in July this year, we included a new section, which has not been included before in a JMP report, which is titled Menstrual Health. This is a new topic, and it is an issue which has many different aspects. It covers a wide range of different things, from attitudes, beliefs, access to materials, access to facilities, and also social norms and taboos around menstruation. So what we did for the report was that we tried to identify those countries that had nationally representative data, and we were able to find data which we grouped into 4 areas. So the first was national data on awareness of menstruation before first period. The second was on use of menstrual materials to capture and contain menstrual blood. The third one was on having access to a private place to wash and change while at home during last period. And the third was about participation in different activities during menstruation, such as going to school or work or other social activities. So these were the 4 areas where we analyzed data, and these are data which are collected primarily through household surveys, where there is a section in the questionnaire for women and girls. So there is a dedicated set of questions which are only asked to women and girls between the ages of 15 and 49. And they ask a range of different questions on reproductive health and other issues. And we were able to find data for 42 countries. 31 of those had information for at least 3 out of these 4 indicators. Most of them had data on the use of materials. So 39 countries with data on the use of materials, 34 on participation. But only 2 countries had information on awareness of menstruation before the first period. That was Bangladesh and Egypt. Most of the data were coming from Sub-Saharan Africa or low-income countries. Relatively few middle and high-income countries have data on menstrual health. So I'm going to briefly show you the data that we found. The first is on awareness of menstruation, and this varies widely in the 2 countries that we looked at. So although Bangladesh and Egypt were the only countries with nationally representative data, you can see quite big variation here. So only 32% of respondents in Bangladesh were aware of menstruation before their first period, compared with 66% in Egypt. And in Egypt, it was much higher in urban areas, 72% than in rural areas, but there wasn't much of a difference in Bangladesh. There were much bigger differences in Bangladesh to do with the age of the respondent. And in Egypt, we found significant differences between the richest and the poorest, and in particular between those with and without a disability. So quite big differences between countries, but also within countries and amongst women and girls of different ages and different subgroups of the population. But it'd be interesting to see, as more data become available, we'll start to see other patterns in other parts of the world. The second topic that we looked at was about the use of materials. And here that you can see use of materials and a private place to wash and change. So use of materials is in light green and a private place to wash and change in dark green. Both of these were quite high. So use of materials ranged from about 81% to over 99%, so universal coverage. The proportion with a private place to wash and change during menstruation was also quite high in these 39 countries. The lowest were in Niger, Tunisia, Burkina Faso, so 52%, 56%, and 74%. But most of the others were over 80%. But when we looked at private place to wash and change in urban and rural, we did see quite big differences. So in the 12 countries that had disaggregated data for rural and urban, we can see that at least 10% of women and girls living in rural areas did not have a private place to wash and change in these countries. And in Niger in particular, it's over half of those living in rural areas. So starting to see quite big disparities. And where these data have been harmonized, so for example, the mix surveys, the multi-indicator cluster surveys, have collected information on participation in school or work or other social activities, and collected these across a large number of countries. We're able to analyze disparities by urban and rural, by wealth, and by those with and without functional disabilities. And you can start to see some interesting patterns. There was not a very big difference for urban and rural, but there were some quite big differences by wealth and by disability. So for example, If we look at Cuba, 32% of women in rural areas did not participate in one or more of these three activities during their last period, compared with 25% in urban. In Nepal, women in the poorest households, I think, were 4 times less likely to participate than women in the richest household. But non-participation doesn't necessarily reflect exclusion. It may be to do with access to resources. It may be because women and girls are choosing not to participate in these activities. So we really need more data and better indicators to be able to better understand the challenges that women and girls are facing. But we do see quite big differences here in non-participation amongst those with and without a disability. So if women and girls reported having at least one difficulty in seeing or hearing or walking or self-care, communication, if they reported any of these difficulties, then they were classed as having a disability. And for example, in most of these countries, I think, women with a disability were about half as likely to participate as those without. And in North Macedonia, for example, women with a disability were 5 times less likely to go to work or school or other social activities than those without a disability. And lastly, we were able to extract some data from the UN High Commission on Refugees, from refugee camps around the world. These are data from refugee camps in Africa. And you can see there is a target set to try and make sure that at least 90% of women of reproductive age should be able to meet their needs for menstrual materials and facilities in refugee camps. But many refugee camps not able to meet this target. You can see nearly all of the women reported being satisfied with materials and facilities in Mozambique and Iraq, but in all of the other countries, it was much lower. And in South Sudan, Malawi, and Cameroon, less than half of the women in refugee camps were able to meet their needs. So quite striking challenges around menstrual health, but we still have some work to do to refine these indicators, to harmonize the data that are collected across countries, and to be able to produce better estimates in future. I just want to end with a couple of slides. One is just to emphasize the amount of progress that has been made. If we look back to 2000, we can see billions of people have gained access to services over that period. 2 billion people gaining access to safely managed drinking water, 2.4 billion gaining access to safely managed sanitation services, and 500 million people gaining access to basic hygiene services just between 2015 and 2020. So, the world is making progress, and of course, the global population has increased over that period. From 6.1 billion in 2000, it's now around 7.8 billion. So keeping up with population growth and extending services to the unserved remains a big challenge, but let's not lose sight of the progress we've made. But in order to track that progress, we do need to invest in improving the availability of data, and we still have some big data gaps. So the next slide just shows data availability for our headline indicators. This table is showing both the number of countries which had data in 2020, and also the percentage of the population which is covered by the data which are available. And those where the data covers less than 50% of the population are highlighted in yellow. So you can see almost all countries in almost all regions of the world had very high coverage of data on basic drinking water and basic sanitation. And many countries actually had data on basic hygiene, but we see that many of them have it for rural, but not for urban. We have good data on hygiene, as Rick said, for low-income countries, but many middle and high-income countries still have data for less than 50% of the population. But then when it comes to data on safely managed drinking water and safely managed sanitation, this is still a big challenge. We do have data for safely managed sanitation for around 81% of the population, because we have data for China and India. But that's because many countries have data on treatment, but relatively few have data on disposal of wastes from septic tanks and from pit streams. So if you look at the proportion with information on wastewater treated, you can see most regions are over 50%. We still have a small number of regions with limited data on wastewater treatment, but they tend to be the regions where people are mainly using septic tanks and pit latrines. But all regions lack data on safe management of waste from on-site sanitation systems. So emptied and treated, that column in the middle there, you can see very small percentage of the population with data available, and this remains our single biggest data gap for national and global monitoring of the SDG WASH target. So this is really where we're going to need to focus our efforts going forward in order to be able to estimate current levels of service, but also to be able to track changes over time. That's my last slide. So I'm just going to turn back to Rick in case there are any further questions before we wrap up.
Thanks, Tom. It's really exciting seeing this new area of monitoring with menstrual health. It's something that's been advocated for a long time. And while these are limited data now, I'm sure that we'll get more and more data on this as we go forward. I would like to open the floor now. We still have about 100 participants, a lot of people from different countries, and we would be very keen to hear from you what your experiences are at the national level. How are the SDGs being monitored? Are there efforts being taken to strengthen national systems, or should there or could there be efforts like that? So whether it's about drinking water, sanitation, hygiene, menstrual hygiene, please share your experiences, your thoughts, and your questions. And again, you can raise your hand and then we can unmute you, or feel free to type something into the chat or the Q&A. Okay, I see, Nom Pumelelo Nchalanchali Motsa is raising a hand, so I'm going to unmute you, ask you to introduce yourself and go ahead.
Hello, can you hear me?
Yes, we can.
Great, thank you so much. Firstly, my name is Nom Pumelelo Nchalanchali Motsa from the SWA Secretariat. Thank you for the presentations and the snapshot and indications of the status quo in the regions regarding the JMP reporting. Mine is, I'm more interested on you mentioned that there are only 28 countries, which is quarter of the population, had no hand washing facilities at home in 2020. So my concern is hand washing facilities is part of the COVID-19 response plan. And if we are not doing so well, what then can we do to strengthen our monitoring or to strengthen our response in countries? For me, it's just that I think all we have to do, there is a lot of activities happening in countries, and there are so many partners. Tom said it right earlier today that we need to strengthen on coordination. I agree. coming from an experience working for government and also being a data collection focal point in one of the countries for government, I can agree that really there is need for more work to be done regarding strengthening the multi-stakeholder platforms. There are so many partners that are working in parallel at national level, which are not well coordinated. So also the reliable data, harmonizing data at national level could improve the status, could improve maybe the service levels at country level, particularly the data collection or the services. So mine is really, I would just emphasize that let us talk to each other at country level. Let us strengthen the coordination. Let us strengthen the multi-stakeholder platforms. Let us know who's doing what and where in each country at national level. Then that would help improve our work at country level. Thank you so much. Over. You are muted.
Oh, just thank you so much for those comments. Of course, I agree with you on the need to harmonize data and to coordinate among the different actors at the national level and the subnational level. I think the particular issue of hygiene that you mentioned in your example is one that needs maybe even more work on coordination. We've seen that in some countries, the government partners have been quite active in water and also in sanitation, but it's not always been clear what their role or their contribution or the actions could be around hygiene. Is it limited to awareness raising and communication campaigns, or are there concrete activities around increasing access to hand washing facilities in the home? What can and should countries be doing to get more people access to basic hygiene in the home? So I think we're seeing examples from countries where they are doing things. They're lowering tariffs on some imported supplies that might be bottlenecks. They're investing in subsidies, but there are still a lot of different type of actions that countries can take to improve hand hygiene in particular. So coordinating and sharing experiences through mechanisms like SWA will really be important. Do we have any other experiences or comments to share from the floor? I see there's a question that's come in the chat from Valiapan about the inclusion of leakage rate as one of the parameters in the SDG 6 scorecard. So I think this might be referring to piped water systems and the amount of water that's lost in networks. We do find that a lot of countries set national targets and build monitoring systems around non-revenue water, which is a critical parameter to improve service delivery in pipe systems. That isn't part of the global indicators for SDG 6. But I think it can very much play a part in national indicators and even regional indicators. The 2030 Agenda for Sustainable Development does call for countries and also regions to set national and regional targets and indicators to complement the global ones, as relevant given the local context. And it would be nice to see more coordinated work done around non-revenue water and what actions countries can do to reduce leakage to more manageable levels so that the quality of services can be delivered more. Maybe after the SDGs, that would be part of a global indicator, but for now, I think it'll remain at the national or regional level. So the floor is still open. I see Nohal Alhomsi raising your hand. I'm unmuting you, Nohal. Please share your experiences.
Yes, good morning. Good morning, everybody. I have just one issue. We did the GMP for Lebanon. We have the recent data, but now everything has changed. especially due to shortage of fuel and the economic crisis. So we have at 71% do not have access to water. It's not only the issue of water quality, it's also water quantity, polluted chlorination and all this. Does this will be reflected on the GMP for the next data? Because things have changed really drastically. And we need to do some an assessment, a rapid assessment to see what's the situation. How can you as GMP or as rapid assessment, can you help in this respect? And I think we need to do another survey to see what's going on, because the situation is very, very critical. Thank you.
Thanks, Nohal. It's a really good question and point. How can JMP statistics be updated? How can countries get updated information on WASH, especially when events lead to very rapid changes, often deteriorations due to some kind of conflict or COVID, or I mean, Lebanon has had a rough year. So this is a challenge for us at the global level, because at the JMP, we take all of the relevant national data that we can find over a long time period, and then use models, linear regression, to see what the trends are and what the current rate might be if the last data point is a few years old. But that method has real limitations for capturing these very sharp changes, especially when rates of progress change. What we can do at the national level is first to support the collection of fresher data. We do have some funds to support data collection. There was a national survey done in Lebanon a few years ago that JMP and especially UNICEF gave some support to. And we can certainly do that on a limited case-by-case basis going forward, especially where there are data gaps or where there's been some kind of big change. When it comes to how recent data impact our estimates, we do have these linear regressions, so there's a weight of the older data points. But if the national authorities, make it clear that those older data points aren't reflecting the current situation, we do take that into consideration and see how we can make sure that the information in our reports, in our database, come as close as possible to reflecting the latest up-to-date situation. One way we do that is through sharing the country files where each individual data point is shown. So you can see if the last one or last several data points show a different situation than the historical trend. The country files are one way to see that. But I think the key is to get more data that reflect the current actual situation. And we're happy to support either through technical assistance or sometimes through supporting some elements of data collection.
Yes, we need, I think, such data collection also to take actions to improve with the situation, and also for the GMP. So it will be both. For both. It will be thank you.
Thanks, Nohal. Well, some of the data that have been collected in Lebanon over the past years have been really good examples of localizing the SDG indicators, adopting the new core questions and indicators, whether it's in households, schools, or healthcare facilities. So I have confidence that you'll be able to find some new data very soon to give a better picture of the current situation.
Yeah, thank you. Maybe we should start also with the health sector because they don't have water, and that's another big problem, I think.
Yeah, no, it's an emergency situation, really.
Rick, we're running up against the clock, so I think we should probably call the session to a close. I would like to take the opportunity to thank the organizers, UN Water, and also our panelists and our participants. As you saw from the chat, there are webinars going on for the rest of this week, so have a look at the list and please do join other webinars if you're interested. And we will be running this webinar again a bit later today if you missed part of it, and we will make the recordings available afterwards, so you'll be able to listen at your leisure. But I think for now, we're probably going to close this one. So on behalf of the WHO, UNICEF, JMP team, thank you very much. And yeah, we look forward to continuing to work together to try and strengthen national and global monitoring of these SDG indicators in future.
Thanks so much, everyone. Bye.
Bye-bye.